Good morning. Thank you for the opportunity to speak to you today as the National Volunteer President of the 38 million member organization called AARP on this important topic, Nursing 2020-2030. Your deliberations and recommendations and our work at AARP unfold in the context of dramatic demographic change. By 2030, 1 in 5 Americans will be 65 and over. The fastest growing age group is comprised of those over 85. We might have 1 million people age 100 or over by 2030. AARP is committed to maximizing the capacity of nurses to meet the healthcare needs of older adults. We have strongly supported the recommendation of the first IOM Future of Nursing report that all nurses practice to the extent of their education and training. Full practice authority provides greater access to healthcare for older adults, especially in rural and medically underserved communities, and lessens the caregiving burden placed upon many family caregivers. AARP has played an important role in advancing full practice authority at the state level, and we are working to achieve this goal in every state. Just as the aging of our population points to the need for full practice authority, it also underscores the urgency of education and training in geriatrics. A 2016 National Academy of Medicine paper noted that the healthcare workforce, including nursing, is not prepared to care for the rapidly growing number of people in the U.S. over age 65. It is pointed out that nursing is deficient in geriatrics, with less than 1% of registered nurses and 3% of APRNs certified in geriatrics. While we all intensify efforts to prepare more nurses to understand geriatric consumers and to work as geriatric specialists, we need to make sure every nurse working with seniors is trained to communicate and collaborate with family caregivers. Optimally, this training will occur in academic nursing programs, but it is also imperative to include this type of training in professional development for practicing nurses working in a variety of settings. We are encouraged that many organizations are working to achieve more effective coordination between nurses and family caregivers. The Home Alone Alliance, an AARP collaborative on caregiving, has found that half of the 40 million family caregivers in this country are performing medical nursing tasks for individuals with challenges in physical, cognitive, and behavioral health. We have to make sure nurses are well prepared to communicate clearly with family caregivers and to give these caregivers the instruction and information they need. Now I want to turn to my primary focus, a topic inseparable from all the others: social determinants of health, the external factors that account for most of the variation in healthcare outcomes. These external influences, which in many cases overlap, encompass social isolation, poverty, food insecurity, poor air and water quality, smoking, substance use and abuse, homelessness, and violence. I listed social isolation first for a reason. While social isolation is not uniformly recognized as a social determinant, it should be. The National Academy of Medicine should specifically recognize and recommend to policymakers that social isolation be addressed as a social determinant. We have made very meaningful progress in healthcare for people of all ages through a passage of the Affordable Care Act, and it's now almost universally accepted that people should be covered for pre-existing conditions. Now we need to build on that progress by making sure that social determinants of health are a central part of the debate and decisions about improving healthcare. AARP Foundation, which works with vulnerable older adults, 50 and over, is immersed in a number of initiatives dealing with social determinants of health. The foundation is also a co-founder of the Root Cause Coalition, which highlights social determinants as the root cause of health outcomes and works to achieve health equity through cross-sector collaboration. The coalition is made up of more than 65 leading health systems, hospital associations, foundation, businesses, national and community organizations. A primary focus of the AARP Foundation's work is social isolation, which affects 1 in 5 older adults. One study has shown that the health risks of prolonged social isolation are equivalent to smoking 15 cigarettes a day. Another study found that isolation and loneliness are worse for health than obesity. They shorten life and make us physically and cognitively less healthy. Another AARP study found that a lack of social contacts among older adults is associated with an estimated $6.7 billion in additional Medicare spending annually. AARP Foundation created a platform called Connect to Affect, which provides tools and resources to identify the risk of isolation. More than 85,000 individuals have taken the step to understand their risks of social isolation through the Connect to Affect online assessment. The foundation has also addressed the interwoven issues of isolation and transportation through a pilot project in which a group of seniors were offered free rides to both medical and non-medical destinations delivered through the ride service, called Lyft. This program is a collaboration of AARP Foundation, the USC Center for Body Computing, and United Healthcare. Now in the evaluation stage, the project was designed to learn whether cost-free, on-demand rides reduce social isolation and missed medical appointments among approximately 150 Keck Medicine of USC consumers over the age of 60. AARP Foundation is also tackling another social determinant taking a heavy toll on older adults: food insecurity. 1 in 12 adults, 60 and older, report a lack of consistent access to a minimum amount of nutrition, underlying their ability to live a healthy and active life. Since 2011, AARP Foundation's drive to end hunger has donated more than 41 million meals to food insecure older adults in the United States. Starting in spring 2015, the foundation teamed with the United States Department of Agriculture, Vanderbilt University, and Tennessee State University on the food insecurity initiative known as FINI. This program ended in March of this year, offered SNAP recipients in Mississippi and Tennessee an incentive to purchase fresh fruits and vegetables at farmers markets and Kroger stores. The program is now in the evaluation state, but we're examining these incentives, increase consumption, and improve attitudes of older adults around healthy living are now currently being evaluated. While we still do not have a final evaluation, the indicators are encouraging. As we consider these initiatives addressing social determinants through assessments for isolation and helping patients to get to medical appointments and helping vulnerable older adults get nutritious foods, we should keep in mind that nurses are well qualified and well positioned for an important role in similar projects. Nurses are more trusted, as you know, than any other profession, and are woven into the fabric of communities in ways other healthcare practitioners are not. You've heard some of them: schools, hospitals, prisons, other places. We need to leverage the skills, the perspectives, and the trust that nurses have gained as well as their role as a hub in healthcare delivery to enable them, where possible, to change the equation fundamentally shaped by social determinants. I will mention 3 innovative programs where nurses are part of a team transforming healthcare as they address social determinants. One is at the Johns Hopkins School of Nursing's Capable Program, which stands for Community Aging in Place, Advancing Better Living for Elders, which is designed to facilitate aging in place while keeping costs low. This program enables adults with low incomes to identify their own self-care goals and then brings in an interdisciplinary team of professionals, a nurse, an occupational therapist, and a repair person, to address both the home environment and the strengths and resources of the older adult. AARP and AARP Foundation are working to expand this program. We are assisting in transforming this program from a research-based program to a social enterprise by collaborating with Johns Hopkins to foster innovation to ensure that the program is scalable. We have also developed a pilot program with the VA to test Capable with senior veterans. If the pilot is successful, the VA has the option of making the program available to all veterans. The Capable program could also potentially become a Medicare benefit. Another compelling initiative targeting social determinants is the Richmond Health and Wellness Program, a nurse-led interprofessional model at the Virginia Commonwealth University School of Nursing. The program focuses on vulnerable older adults and disabled adults in low-income housing. Groups of 4 or 5 health professional students meet with older people to discuss their ailments, make referral appointments, and try to solve problems early. The program describes itself as bringing services to individuals at their place of residence with unmet social determinants, often impacting health and daily living. The final initiative I'll mention is not one far from here. The National Center for Complex Health and Social Needs, part of the Camden Coalition of Healthcare Providers in New Jersey. The aim of the center is to improve care for high utilizers, the relatively small percentage of the population whose repeated trips to the ED or hospital stays are associated with poor health results and high costs. AARP is a founding sponsor of this center, along with Atlantic Philanthropies and the Robert Wood Johnson Foundation. We need an exponential increase in programs that recognize the inextricable link between health needs, social needs, and that target both. So, to expand the capacity of nurses to help drive this effort, we recommend that schools of nursing develop strong population health curricula so that nurses are better educated in social determinants of health. That there be increased screening by nurses for social isolation, food insecurity, transportation, and housing concerns, and other social determinants. That when nurses identify issues through screening, they make sure these issues are communicated to the consumer's broader health team so that these concerns can be addressed in a collaborative way. That nurses develop an increased understanding of how to connect patients with community resources. And that nurses assume leadership roles in the community in support of needed services and to bring their lens of health and wellness to all areas of public life. Thank you again for the opportunity.